Hello, good morning, students. This is Dr. Amar Dwivedi, Professor and Head of Shalyatantra Department at School of Ayurveda, D.Y. Patil University, Navi Mumbai. My today's topic is on basic principles of bloodletting, that is Raktamokshan Chikitsa, and we will elaborately discuss about Sira Vedha, that is venipuncture method of Raktamokshan. Before directly going to Raktamokshan, we will quickly review about the concepts of Ayurveda. We all know that body is formed by dosha, dhatu and mal, and out of these, three doshas are considered more important as they form a base in nourishment and development of the body. And further, whenever there is a disequilibrium of doshas occurring, it directly affects the health of the individual and pathogenesis is introduced. Further, the next concept is about the treatment methodology. We all know that Ayurvedic treatment principles again are divided into Shodhan Chikitsa and Shaman Chikitsa. The Shaman Chikitsa is simply the medicinal treatment or the palliative treatment in which the various formulations are given orally internally to the patient and the doshas are pacified or cured. This is done in subacute condition or the condition where there is comparatively less amount of vitiation of doshas uh, is noticed. Whereas the Shodhan Chikitsa is commonly known as Panchakarma Chikitsa, is something very special treatment methodology in Ayurveda. This is called as elimination therapy, and there are different modalities of this Panchakarma therapy by which the vitiated doshas are expelled or removed from the body. The basic types of Shodhan Chikitsa are Vaman, Virechan, Basti, Raktamokshan and Nasya or Sirovirechan. These are the five different modalities of Shodhan Chikitsa. They are opted when there is comparatively large amount of vitiation of doshas first, and when the condition is very chronic. So to get permanent cure of the ailments, we go for Shodhan Chikitsa in Ayurveda. Now coming to the today's topic, that is Raktamokshan. What is Raktamokshan? We have already discussed. It is expulsion or removal of blood for therapeutic purpose is called Raktamokshan Chikitsa. Now Raktamokshan again is divided into two categories. One is Sashastra Raktamokshan and the other is Ashastra Raktamokshan. Ashastra Raktamokshan is something where there is no use of any instrument or needle or blade, and without use of these instrument, when bloodletting is performed, it is called Ashastra Raktamokshan. For example, leech therapy. In leech therapy, we don't use any instruments for blood removal. Simply the leeches are applied and blood is removed from that part. That is Ashastra. Now coming to Sashastra Chikitsa. Shastra Raktamokshan is something where there is use of surgical blade or needle for removal of blood. Now, the major type or the main type of this Shasastra Raktamokshan is Sira Veda Chikitsa, which is commonly termed as venipuncture, and this is one of the easiest method of Raktamokshan. Now, which are the factors to be considered before Sira Vedan? As a standard operating procedure, we divide the Sira Veda treatment also in Purva Karma, Pradhan Karma and Paschata Karma. Then one should know about the exact indication and contraindication of the therapy. Now directly coming to the Purva Karma of Shiraveda, selection of suitable patient is the most important. Then half hour before the Shiravedhan, patient is offered Mrudu Snehan and Svedan. Patient is given Laghu Ahar like Yavagu or soup. Then most important part is one should rule out various coagulatory disorders like hemophilia, anemia, then diabetes, hepatitis, HIV and other infectious diseases. Now for Sirave, the patient is given supine or slightly popped up position. Before the starting this Sira Vedhan, Mangal Swasti Vachan as a tradition of Ayurveda is offered, which means chanting of mantra to start positive vibes in the environment. Now, vein is selected for puncture, and a tourniquet is applied little above this site, and this should help in making the vein prominent, and this is released once the vein puncturing is done. So this is all about the purva karma of Siraveda Chikitsa. Now coming to the season or the time for Siraveda Chikitsa, in the textbook it is mentioned that Siravedhan Chikitsa is to be done in the Sharad Ritu, and most important in Grishma Ritu Siravedhan is contraindicated. Now coming to the exact indication of Siraved, when one should go for Siraveda Chikitsa. So Ayurveda is useful in various skin disorders like eruptions, boil, inflammation, cellulitis. Then it is effective in Raktaj Roga, that is blood-borne diseases like Visarpa, Pliha, Vidradhi, Kushta, Gulma, Vyanga, Tilakalak, mole, warts, etc. It is clinically seen that Sira Veda Chikitsa is also useful in hypertension, eczematous dermatitis, psoriasis, obesity, toxemia, various vascular disorders, non-healing ulcers, and early stages of filariasis. Further, I would quote that if a person or individual voluntarily donates blood once in a year, that will also serve the purpose, and he will be always benefited with all the positive outcome of Siraveda Chikitsa. Now coming to the contraindications of Siraved, this is also very important where Siraved should not be done. So the contraindications of Siraveda is Bala, it should not be done in Bala Vriddha, Ruksha, Kshatak, Kshina, Krisha, Bhiru, Parishranta, Stri Karshit. Friends, all these conditions are nothing but the condition which result into extreme Vata Prakop. So, if patient is having Vata Prakop symptoms, one should not go for Raktamokshan. Then it is not to be done after Vaman, Virechan and Basti, immediately after Vaman, Virechan and Basti. It is not indicated in the insomnia patient, not in the sleepless condition, not in Garbhini, not in Klebe. Then anemia patient, hemophilia patient should not be done with the Siraveda Chikitsa. Then again, if the patient is suffering from cough, breathlessness, muscular wasting, fever, convulsive disorders, paralysis, giddiness, patient who are fasting or thirsty, in such cases Siraveda Chikitsa is not done. Now coming to the material used for Siraveda or venipuncture, well, practically we are using vein flow or scalp IV cannula having a needle and attached cannula for the Raktamokshan Chikitsa. But in textbook they have given 4 different material to be used for venipuncture. They are Brihimukhi Shastra, Kutharika, Vetaspatra and Ara Shastra. Now out of these, Brihimukhi Shastra is something known as trocar and cannula, which is very much similar to the vein flow which we use for the Siraveda Chikitsa. Now directly coming to the Pradhan Karma of Siraveda, what we do in the main procedure, after applying the tourniquet, prominent vein is selected and punctured with the instrument or the scalp vein, and needle is fixed with this sticking plaster. Next is most important, BP cuff is applied on the opposite arm and the pressure is maintained around 80 mm of mercury. Then blood immediately starts flowing out of the cannula, which is collected in the measuring pot. After certain time, you can notice that bloodletting slows down and spontaneously arrest of hemorrhage takes place. This is known as Raktam Swayam Eva Avatisthati. Preferable amount to be removed is 80 ml to 120 ml, where in the textbook the maximum amount to be expelled given is 13.5 pul. Now this is the unit. We know that 1 pul is equal to 50 grams. So maximum amount of blood can be removed is 750 ml. That is around 2 pint of blood which is given at a time, which can be removed at a time. Now coming to the paschat karma, after desired bloodletting is done, scalp vein is removed, pressure is applied with swab. Ayurvedic text suggests that you can sprinkle haridra or laksha churna for hemostasis purpose, and then a pressure bandage is given. Patient is offered a light diet after that, and he is instructed to take sansarjan kram, means slowly, gradually he has to go with the normal diet. Most important, after Vene puncture, if patient is feeling giddiness or weakness, you can offer lime water or glucose water or tomato soup like thing. Then coming to the rule of Siraved, which vein is to be selected, from where the Siravedhan is done. There are two theories. One is, for Sarvadehik Siraveda, one should opt cubital vein, which is in the cubital fossa of the elbow, anterior side of the elbow. The other rule says that Siraveda or bloodletting from venipuncture is to be done by peripheral veins or the nearby vein where the pathology has been situated. Okay. Now coming to the, after the pradhan karma is the paschat karma. Paschat karmas are, we have already discussed about it. Now coming to the causes of failure of Siraved. This is very important, friends, because many a times you cannot go for the venipuncture. So which are the causes for failure of Siraveda? We will discuss in brief. Faulty technique, collapse of veins due to shock condition, low blood pressure, obesity, anxiety, over exertion or weakness. Most important is the dehydration, then fear, then loosening of tourniquet, blunt instrument, and Siraved done without Snehan Svedan. Now quickly we can divide these causes of failure of Siraved into Shastra dosh, Rogi dosh, Yantra dosh, Sira dosh, and Vaidya dosh. Shastra dosh is, means if there is a fault in the instrument. Rogi dosh if the patient do not cooperate. Yantra dosh is if the cannula having some defect. Sira dosh if the veins are not proper. Vaidya dosh is faulty technique by Vaidya. Now coming to the adequate symptoms of Siraveda, that is Samyak Siraveda Lakshan, they are Laghavam, Vedanashanti, Vyadhi Vega Parikshaya, Mana Prasada, Rakta Swayam Eva Avatistati. These are the adequate signs of Raktamokshan. Now most important are the 12 signs of excessive blood loss. This is very important. 12 signs of excessive blood loss. Raktasrav, Ati Raktasrav Lakshan, Siro Abhitap, Andhyam cha Adhimantham, Timir Pradurbhava, Dhatukshaya, Akshepak, Daha, Pakshaghat, Hikka, Shwas, Kasa, Panduroga, Maranam cha Apadayati. Means patient, if the excessive amount of blood is removed, patient may feel of headache, warmth of head, blurring of vision, he may develop glaucoma, refraction error, then emaciation, convulsions, burning sensation, paralysis, hiccup, cough, breathlessness, Pandurog, that is anemia, and Maranam cha, means patient may die because of excessive blood loss. And the last part of Raktamokshan concept is one should know the importance of Shiraveda Chikitsa. So there are three major reasons for supermacy of Siraveda among the bloodletting therapies. Most important, write down, it is the only therapy which helps in eliminating all the three vitiated doshas, that is Vata, Pitta, Kapha, at a time. So if person is not having sufficient time to go for entire Panchakarma, only Panchakarma, only this Raktamokshan can serve the purpose. Second is Blood being the vehicle to carry and transport absorbed nutrients, oxygen, metabolite, etc. from place to place. So correction in the abnormality in the blood by taking it out solves a number of problems. And lastly, those who get Raktamokshan regularly done as a routine, they never suffers from Tvaka dosh janya vikar, they never suffers from Raktaja roga and inflammation. Such is the miraculous effect of bloodletting therapy. So friends, this was all about the basic concepts of Raktamokshan, and we have elaborately discussed about the major type of bloodletting, that is known as Sira Vedha Chikitsa. With this, we conclude today's session. Thank you, one and all.